Okay, hello, Ms. Keith. My name is Shanika Howard. For this project, I chose cerebral palsy. Um, so I guess I'm going to start presenting now. The most common cause of severe disability in childhood is cerebral palsy. According to Ham and the Gale Encyclopedia of Neurological Disorders, published in 2017, cerebral palsy is a term used for a group of non-progressive disorders of movement and posture caused by abnormal brain development or damage to motor control centers in the brain. You can either be born with cerebral palsy, or it can occur during birth or after birth from some type of brain damage. According to Ham and Gale Encyclopedia of Neurological Disorders, there's currently 764,000 children and adults with symptoms of cerebral palsy. Um, there are more than 8,000 babies diagnosed with cerebral palsy yearly. Roughly 1,500 adolescents or preschool children are diagnosed. It's hard to diagnose cerebral palsy because it deals with motor delay milestones. So when the doctors look for diagnosing cerebral palsy, they look for whether your baby can sit by itself, stand, walk, crawl, if the child's able to hold their head up on their own without any assistance is another sign that they look for um, with cerebral palsy. Um, so cerebral palsy is it's non-progressive. It occur can, like I said earlier, can occur in developing fetus from a brain injury. The motor disorder is accompanied by disturbances of sensation, cognition, communication, perception, behavior, and seizure disorder, which meaning it affects their communication. Some are nonverbal; they're able to make sounds but aren't able to articulate words. They movement. Some are not able to walk. You have some that can, but some, the more severe cases, aren't able to walk or do anything for themselves. Um, the etiology of cerebral palsy in infants is unknown, but they contribute some causes to having cerebral palsy as low birth rate, premature separation of the placenta, abnormal fetal position associated is also can be associated with cerebral palsy. So my patient is a 12-year-old African American. He's diagnosed with quadriplegic spastic cerebral palsy, which is the most severe form of cerebral palsy. It affects all limbs of the body. It severely affects the upper limbs more so than the lower limbs. My patient has contractures to the upper right arm, contractions to both wrists, presents with the lower limbs abducted. He is GJ babe. He receives medication and nutrition through his GJ tube. He's bed bound. He's incontinent. He wears a brief. He's nonverbal. Um, Vital signs are within normal limits. He's secondary to cerebral palsy. He has cardiomyopathy, severe kyphosis. Um, so, according to Myers and Shapiro from Origins and Causes of Cerebral Palsy published in 1999, physicians found it hard, like I said earlier, to diagnose cerebral palsy because it deals with the motor delays. Um, to diagnose it, They, like I said, they look for to see if the baby could crawl, walk, talk. They also do CT scans, MRIs. EEG can be performed. Genetic testing, metabolic testing can be done alone, or these tests can be done in a combination to diagnose cerebral palsy. Cerebral palsy cannot be cured, but the goal is to use a combination of things to alleviate the symptoms, fires like physical therapists, medical, chemical, surgical, technical procedures. Um, the goal is to prevent also to prevent secondary impairments and improve child care development capabilities. So for my patient, he uses medications to alleviate the symptoms of seizures as well as spasticity. He gets Botox for his hypertonicity. He also, let's see, he receives two different type of seizure medications. He's physical therapy. He has a tutor whom which comes to see him twice a week for 1.5 hours. Um, he's bedbound, so he's total care. He has a lift and he uses a wheelchair to get around. Cerebral palsy is permanent. It does not get worse. It can get as the child get older, but a child can live with cerebral palsy for 30 to 70 years, which is better. The child is more likely to die from a secondary diagnosis before they would die from cerebral palsy. So since my patient is on a more severe side of cerebral palsy with being diagnosed with quadriplegic spastic cerebral palsy, he will be susceptible to having a lower prognosis for survival rate. He's would probably die more or less from the kyphosis because the kyphosis has caused him to have to be trached and get an airway. He's now vent dependent, and he's also a GJ baby. So yeah. So with the cerebral palsy, he wouldn't get any better, but he wouldn't get worse at the same time. So just with treatment, medications, old occupational therapy, physical therapy, sometimes speech therapy for those who are not with the more severe case, can help with the symptoms to cerebral palsy. So yeah, this is my presentation. Thank you.